Good day, everyone. I, JP Arbres, Ira Ole, Linnea Wenceslao, and Michael Sevilla will be presenting a case for our clinical pathological conference.
A female mixed breed dog was brought to Servicio Veterinary Animal Clinic, Dasmariñas branch for consultation due to hard abdomen, vomited twice, and not being able to defecate the night before the consultation.
The dog presented is 13 years and 5 months old. Female intact mixed breed weighing 5.05 kilograms. The owner said that it has a good appetite and its diet was chicken breast with vegetables and also had a history of ticks. Upon physical examination, it was observed that the abdomen was enlarged and with no vaginal discharges. The body temperature was 38.8 degrees Celsius. The heart rate and the respiratory rate were normal. Four tests were conducted, which are complete blood count, blood chemistry, ultrasound, and X-ray.
The initial assessment based on CBC findings, there is no significant decrease in erythrocyte count or signs of anemia since hemoglobin levels are in normal level range. There is a significant increase in leukocyte count, which can indicate inflammation or possible bacterial infection. For the blood chemistry, the increase in BUN may be due to dehydration or increased reabsorption in urea in the intestine due to difficulty at defecation. An increase in alanine aminotransferase or ALT increase can indicate poor perfusion or stress. In the lateral abdomen radiograph, there is an opacity in the abdomen cavity and enlargement of the uterus from cauda-dorsal area. In the sonographic view, ultrasound anechoic areas in the uterine horns and hypoechoic mass cranial from the uterine horns are observed.
For the differential diagnosis, uterine tumor, ovarian tumor, and pyometra were all considered. The hard abdomen in the dog was an enlarged uterus as revealed on the abdominal radiograph and ultrasound. Thus, uterine tumor and ovarian tumor was considered. There are no clinical signs seen in these tumors unless the gastrointestinal or urinary tract is affected. Nonspecific CBC and blood biochemistry results are observed. They may be a concurrent condition or predisposing factor to pyometra and may be discovered as an incidental finding. The constipation and vomiting may be due to compression in the gastrointestinal tract because of the enlarged uterus. Based on the clinical signs and laboratory findings, the initial diagnosis was closed-type pyometra.
The treatment of choice in pyometra is ovariohysterectomy. A ventral midline incision was done and upon exploration, multiple nodules, mass, and serous sanguineous polycystic uterus were observed and removed from the dog. The excised uterus weighed approximately 2.1 kilograms and after the surgical procedure, a portion of uterine horn and body was submitted to the diagnostic laboratory for biopsy.
The biopsy result report are as follows. Cross findings. The specimen consists of cream to white brown irregular tissue fragment with an aggregate diameter of 5 cm. Microscopic findings. The tissue section characteristically present a notable proliferation of densely packed, moderately pleomorphic spindle cell that retains many features of normal smooth muscle cell and are arranged in a broad interlacing fascicles. The said mass is more cellular due to diminished cytoplasm and closely packed nuclei of individual neoplastic cells. The said nuclei are mostly round to elongate with chromatin that may be granular or markedly dispersed. Anisokaryosis and anisocytosis are moderate. Mitotic figures are variable. Marked signs of hemorrhage and congestion can be observed primarily along the mucosal surface of the said embedded section. Diagnosis: findings indicative of leiomyosarcoma, intermediate grade. Specimen received: found in the uterine horn and the body. Uterine leiomyosarcomas are tumors that arise from the myometrium. Leiomyomas are benign, small, encapsulated, slow-growing, and do not metastasize. Leiomyosarcomas are malignant tumor with metastatic potential, most often beginning in the abdomen or uterus. It starts as a growth of abnormal cell and often grows quickly to invade and destroy normal body tissue. There are mostly incidental findings and require histopathology for a definitive diagnosis. Most uterine tumor cause no clinical signs unless gastrointestinal or urinary tract are affected. Signs associated are abdominal distension, enlargement, or palpable abdominal mass, abnormal ester cycle, vaginal discharge, pyometra, polyuria or dysuria, polydipsia, vomiting, constipation, and weight loss may be observed.
For postoperative treatment, home medications were given, like antibiotics, iron plus B complex supplement, kidney and liver supplement, wound cleanser, wound ointment, and kidney or renal diet. Additional instructions to the owner were also advised, like wear an e-collar all the time except during meals. Keep the wound clean and dry. Syringe feed or drink if no appetite. Isolate from other pets to avoid dehiscence of suture. No strenuous activities. Cage rest. Suture removal after 10 days. A week after the surgery, the dog was presented and returned to the clinic for a follow-up checkup. CBC or the complete blood count results did not improve as much. However, the WBC count is within the normal range. After a month, aside from increased platelet count, all CBC findings were within normal range. However, in the radiograph, radiopaque structures were seen, suspecting early metastasis. Other medicines were halted and prescribed an anti-cancer supplement and multivitamins. The owner was also advised to monitor the dog for signs like difficulty in breathing, weakness, and inappetence, and to bring it to the hospital if symptoms persist or occur.